thank you for inviting me to participate in this important webinar. I helped start our committee a little over a year ago because, like every teacher, I felt abandoned by our leaders, our administrators, and worst of all, our unions. No one seemed to care that teachers were on the front lines facing a threat that might very well kill us and our families. I hope through my remarks to illustrate the disconnect between the policies, protocols, and mandates that are haggled about in governments and in the press and the daily lives of workers who face the uncertainty and threat of severe illness, financial precarity, and possible death as the pandemic continues. Last year, teachers were on our own. We were unable to practice social distancing in classrooms full of students who had to constantly be reminded to wear their masks correctly. Many of us were lucky if we had doors and windows we could open to circulate air into our poorly ventilated classrooms. It became immediately clear to teachers that mitigation strategies were not going to work in schools. The numbers of cases by December confirmed what we already knew. We weren't going to stop the spread of the virus in schools with masks and hand sanitizer. Teachers saw the writing on the wall, the callous disregard for our lives and our humanity, as exemplified by the push from President Biden and AFT President Randy Weingarten to reopen schools, could not be plainer. Our only value to them is to mind the kids while parents go to work to generate profits for the ruling class. Last spring, those teachers who could left education, but for many of us, we had no choice but to come back in August. This is our profession. I don't think people realize that most teachers have advanced degrees in education. We've spent our lives studying, training, and practicing to be the best that we can be. We love what we do. How do you walk away from your profession? The teachers who returned this year were fully vaccinated. Unfortunately for us, Republican governors in southern states had let mask mandates expire, leaving decisions about mitigation protocols to counties and school districts. What ensued beginning in mid-August as schools reopened was nothing short of chaos as the Delta variant surged through southern states. Case counts and deaths rivaled and in some cases exceeded the catastrophe of the winter surge. 6 close, fully vaccinated mask-wearing colleagues of mine became sick with COVID in September. While none of them were hospitalized, all of them continue to suffer fatigue, breathing problems, and brain fog. They returned from sick leave tired and coughing, only to have to cover classes for colleagues who became sick with COVID in their turn because there's a shortage of substitute teachers. As districts in my state tried to mandate masks in schools again, our governor signed an executive order to allow parents to opt out their children from wearing masks. A federal judge ordered a mask mandate in my district and blocked the governor's opt-out order. This resulted in the closure of our school district because far-right politicians, pastors, and parents threatened to shut down the district in order to prevent the mask mandate from being implemented. When schools finally reopened, protesters lining school sidewalks and driveways heckled teachers and students coming to school, calling them sheep for wearing masks. These community leaders and parents encouraged children to disregard the mask mandate, which caused a breakdown in the order and routines in classrooms. Isolation rooms had to be set up for the students refusing to wear masks. And although the actual numbers of students who refused to wear masks were few, their classmates took off their masks when they realized it would get them out of class. Teachers who were not covering classes for their sick coworkers had to supervise these rooms, which meant giving up their lunch and plan time. My colleagues are already exhausted and we only just got back from fall break. The physical and emotional toll of the pandemic and the politicization of public health crisis is taking on educators is enormous. All over the country, schools and districts are in turmoil as mitigation protocols and vaccinations fall short or outright fail. In the district in North Carolina, where a friend of mine teaches, 524 educators have left the profession since August of this year, and about 100 more are expected to leave in December. In North Texas, districts don't have enough teachers to cover classes or bus drivers to drive the school buses. While the continuing loss of life and long-term effects of COVID are nothing short of cataclysmic, another tragedy threatening us all is the unraveling of the social fabric that enables our communities to function. We can no longer trust our leaders to act in the best interests of workers by following science and upholding our democratic institutions. They have used misinformation to advance their political agendas to ensure that profits do not suffer while the rest of us do. Our leadership's self-interest and cynicism has empowered anti-science and anti-social groups to subvert the orders of judges and undermine expertise of scientists, healthcare professionals, and educators. When is this going to end? Almost 5 million people worldwide have died from COVID, and it doesn't seem to be slowing down despite vaccines and masks. How can a virus that kills so many in 18 months become endemic? Does living with COVID mean that 756,000 Americans dying horrible deaths every 18 months? For teachers and other frontline workers, this is not living. It's a fight for survival. If science does not take the lead by demanding an end to the transmission of COVID, what will happen when this virus develops resistance to the vaccine or a new virus wreaks havoc on society? Workers and scientists must join forces against the profit interests of our governments and business leaders if we're to end the pandemic.